Most children around the world today are having diabetes type I. However, several young adults and children being affected by diabetes type 2 are now starting to rise, especially in America. It is greatly considered that occurrence of diabetes is the outcome of hereditary characteristics activated by environmental features like exercises and diets. Inactive lifestyle and very bad diet are the usual causes of diabetes type 2 among young adults and children. The following signs can be seen in children as warnings that there is development of diabetes: thirst, loss of weight, tiredness, and frequent urination. Among children, particular signs may include headaches, stomach aches, and problems in behavior. Recurring pain in the stomach and history of illness that is unexplainable must be cured immediately because they are indications of diabetes. Most children having diabetes are being referred to regional specialists on diabetes. The patients are very well taken care of in the hospital. The only particular means of diabetes treatment in kids is through insulin. Normally a care team of diabetes will make a plan regarding insulin regimen suitable to individual behavior and necessities of a child. Rapid-acting insulin must be administered usually at daytime, and slow-acting dose of insulin must be given at night. The most common treatment among children is through insulin pumps. Occasionally, in the early period after diagnosis, little kids need an extremely small dosage of insulin. However, the doses will change as children grow larger and older. Excellent control on glucose is important in managing all conditions in diabetes. Treatment of diabetes type 2 in kids depends wholly on the extent of the development of the condition. It can be probably treated with a sudden change in lifestyle incorporated with exercise and healthier diets. Parents' responsibility. Dealing with diabetic child is as difficult for the parents as just it was for the child with diabetes. There will be a lot of things that are to be considered, and it includes on how the parents will take care of their child, the possible social or psychological problems which the child can experience resulting from diabetes, and the cost of care for the child. Observing the blood sugar levels of the child. Keeping away from low blood sugar and high blood sugars can be the biggest part of a parent who has a child with diabetes. Parents should have awareness that their child with diabetes has certain diet restrictions. Their levels of activity must be monitored and observed closely. From the start and all the way through the duration of diabetes, this disease can be a severe tension. Initially, the process of managing and treating a child with diabetes is very complicated. Parents should understand on how diabetes has affected their child so that parents can be adaptable and be patient with the process. That is very important for managing the diabetes successfully. Watch the next clip for more information.
In someone with diabetes, sugar is unable to enter the cells and starts to build up in the person's blood. Over time, this extra sugar can cause problems in several places throughout the body. For example, high levels of sugar in the blood, as well as high blood pressure, can make the small blood vessels in your eyes begin to swell and bleed. When the bleeding goes into the back part of the eye, called the retina, it can cause vision problems and may even lead to blindness in some cases. Having high levels of sugar in the blood can also damage the blood vessels that bring oxygen and nutrients to the kidneys and harm the kidneys' cells. This makes your kidneys have to work harder. When this happens, the waste products that the kidneys usually filter out start to build up in the blood. Sometimes the kidneys will even stop working if the sugar level has been too high for a long time. This is called kidney failure. Over time, high blood sugar can harm the small blood vessels that supply your nerves with blood, oxygen, and nutrients. As a result, less blood reaches the nerves, and they start becoming damaged as well. This is known as neuropathy. Some problems in the nerves can make your feet feel like they are burning or tingling, or even numb. You might notice pain in your arms, legs, or hands as well. In addition to these types of problems, many people with diabetes have both high blood pressure and high cholesterol levels. This puts them at an increased risk for heart disease. Heart disease occurs when blood vessels in the heart become blocked by a buildup of fat and cholesterol called plaque. Eventually, a blocked blood vessel can lead to a heart attack. These problems take time to appear. So diabetes can be damaging your body without you even being aware of it.
Click the link below to make your kid healthy and strong.